Thank you for watching this preparation video for Holmes Clinic. In this short presentation, we will introduce information on how to triage patients while volunteering at Holmes. As an overview for this presentation, we will be covering the basics of triage, roles of Holmes volunteers, details on how to triage, and resources that affect triage decisions. Finally, we will have several practice examples. In your future as a medical professional, you're guaranteed to run into the problem of too many patients, too little time. Triage is a process of sorting illnesses by acuity to help you decide which patients you should be seeing. During Holmes triage, there are three overarching categories for disposition. For life-threatening or higher acuity conditions that require immediate intervention, individuals should be sent to the ER. Transportation options, such as bus, police, or ambulance, will be further explained in a separate slide. Holmes appointments will be reserved for high-priority, non-emergent care that the clinic has the resources to treat. Remember, we only have 6 available appointments, so triage is very important. Have all other patients return during the week, especially for new diagnoses, minor injuries, and preventative health. In general, arrive at Holmes by 9 a.m. ready to triage. In pairs, greet everyone in the sitting area, introduce yourselves, and ask about medical conditions that may need treatment. If an individual expresses interest in going to the clinic for a specific medical problem, explain that appointments may take several hours, which should not prevent them from receiving other services, such as laundry or lunch, from the day center. Do not promise an appointment to anyone. Send them to a clinical science student who will take more information from them. Clinical science students should get more details about the medical problem and about the individual's social situation, including whether or not they have insurance or a gold card, or any barriers to care, such as work, transportation, or mobility issues. It will ultimately be the responsibility of the managers to select which patients will receive an appointment.
When triaging patients, there's an algorithm we can use to help determine which patients to schedule in Holmes Clinic. First, decide if the patient is having an emergency. Emergencies include unstable vital signs or life-threatening conditions such as myocardial infarction or stroke. Additionally, any patient with suspected TB should be advised to go to the ER because some volunteers are not fit tested. In cases of emergency, call 911 and request a preceptor for assistance if present. If the patient is not having an emergency, determine if we can help this patient in Holmes. Refer to the lab tests and medications available to decide whether the patient has a treatable condition. Some treatable conditions are listed on this slide. If the Sunday Holmes Clinic cannot help this patient and hospitalization is necessary, offer a bus pass or call EMS. If hospitalization is not necessary, recommend that patients return during the week for services offered by Cathedral Clinic. Otherwise, refer patient to other sites if necessary. Here's an overview of the entire triage flow sheet. Screen capture this slide if interested in having this flow sheet as a resource. So once you've found someone who is a good candidate for an appointment at Holmes Clinic, speak with a clinical student or manager to determine if there is space on the schedule. Otherwise, the patient will be listed as an alternate. Priority will be given to patients with serious conditions and those who are uninsured. Note, patients who are insured can also be seen in the clinic, but uninsured patients will be given greater preference.
Now we will discuss some resources available at Holmes Clinic. So as we discussed before, in emergency situations, patients must be transported to the hospital. There are various ways to do this based on acuity. For immediate resuscitation, such as someone experiencing a grand mal seizure, call 911 and let your preceptors know immediately. Ambulance rides are expensive. If your patient is unstable and has a serious condition that needs evaluation, but they do not need immediate resuscitation, you can request a police escort. An example of a patient for which this course of treatment is appropriate will be someone with active suicidal or homicidal ideation. However, police escorts are a courtesy to the clinic and are free of cost. Therefore, do not overuse them and use your best clinical judgment. Do not request a police escort on someone who you think will decompensate on the way to the hospital. Finally, if you have a patient that is stable but will require hospitalization, such as someone with pneumonia or untreated AFib, and the patient is refusing an ambulance ride or a police escort, then you can give him a bus pass. The manager will also provide them with a letter that states what we think the patient needs to be evaluated. Emphasize the importance of evaluation at an ER. The following tests are available at Holmes: EKG, pulse oximetry, pulmonary function test, finger stick glucose, hemoglobin A1C, urine dipsticks, which test for nitrates, leukocytes, glucose, and ketones, STI testing including HIV via urine sample, gonorrhea and chlamydia, but note that they won't get the results on that day, they will get them later, and KOH wet prep for vaginal infections. The following services are not available on Sundays but are available on other days at Cathedral Clinic, which is the same place Holmes is at. Case management, counseling, podiatry, psychiatry, and more advanced testing such as Chem 10, also known as a BMP. The following services are not available at all at Cathedral Clinic: dental services and vision services.
So now let's go over some cases. First things that we want to cover are subtle differences in between different cases that might present similarly. Patient A is a 25-year-old with a productive cough and green mucus for 2 weeks. This case is concerning for a bacterial infection given the productive cough, the color of the mucus, and the length of time. This patient we would see in the clinic because we can treat them with antibiotics. Patient B is a 25-year-old with weight loss, productive cough, and night sweats. These symptoms are concerning for TB, so despite the fact that the patient still has the cough, you would not see them in the clinic, but refer them to the ER since they can do further testing. Patient B is a 25-year-old with a dry cough for 1 week with upper respiratory symptoms. This case is concerning for a viral illness, which we can't treat with antibiotics, and is not concerning for a serious life-threatening condition. Therefore, we would refer them to the clinic during the week. Subtle cases part 2. Now let's talk about patient A, a 56-year-old homeless man who just relocated to Houston. He's never seen a doctor in Texas and needs to restart his Haldol and sertraline, but he doesn't remember why. This patient needs to establish care and undergo a diagnosis prior to receiving treatment. Therefore, you would ask them to come back during the week. Patient B is a 56-year-old homeless man with schizoaffective disorder who is asking for a refill of his Haldol and sertraline. Since this patient already has a diagnosis and all they need is a medication refill, you could have them come in for an appointment. Let's go over some practice cases. Mr. E approaches you and says, "I've been having chest pain for the last 30 minutes, doc. I'm sweating like crazy and my arm feels numb." Since this pain is concerning for cardiac origin, you would see this patient emergently and call 911. Mr. I pulls you aside and asks if he can be treated for AIDS. He's had unprotected sex with strangers in the past few months. He has no insurance and he sleeps wherever it's quiet. You would see this patient to test him for HIV, AIDS, and other STIs. You'd follow up during the week for results and see Trauma Street if HIV positive. Miss C is a 22-year-old homeless female who's presenting for dysuria and cottage cheese-like vaginal discharge. You would see this patient to test her for Candida, bacterial vaginosis, UTI, and other STIs with KOH wet prep, STI testing, and urine dipstick. You can also treat her with antibiotics and antifungals, which is another reason to see her today. Mr. Al is a 45-year-old man who complains that he injured his knee. He has an open wound and he hopes for bandages. This patient we cannot see since we do not give out bandages or band-aids during triage. He's also unlikely to get an appointment during the week given his lower acuity situation. Miss J is a 42-year-old woman complaining of severe allergies. She says she must be at work by 12 and needs to see a doctor right away so she doesn't lose her job. You would see if this patient can have the first appointment, but if not, you would ask her to return during the week. That's it for our instructional video. Thank you for watching.